Former U.S. President Joe Biden has been diagnosed with prostate cancer. His office shared the news yesterday, calling the cancer aggressive and saying it had spread to the bone. Biden sought treatment for urinary symptoms on Friday when doctors found a small nodule on his prostate. Biden left office in January at age 82 as the oldest serving president in U.S. history. He and his family are currently reviewing their treatment options. So we're going to turn now to Dr. Christopher Labos, who joins me to talk a little bit more about this cancer diagnosis. He's an epidemiologist and cardiologist. He's also the author of Does Coffee Cause Cancer? We've reached him in Montreal. Good morning.
Good morning.
So we are hearing this sort of Gleason score. I guess it's a sort of a ranking system for the severity of the illness, and his is a 9. Can you just walk us through what that means and why that number matters when it comes to prostate cancer?
Right. So when you take a biopsy of a tumor in a prostate, you look at it under a microscope and you give it a score between 1 and 5 based on how normal the cells look. So if the cells look normal, you give it a score of 1, and the more abnormal they become, the higher the score you give it. So the highest score you can get is 5. And because you look at 2 different parts of the tumor, you sum those 2 scores together. So the maximum worst score you could get is a score of 10, 5 plus 5. President Biden's is a 9, which is essentially just as bad. So it suggests that the architecture of the tumor is very, very abnormal, which is usually a bad prognostic sign.
Yeah, and we're hearing also that the cancer has reportedly spread to his bones. How concerning is that? And what does it usually mean for someone's outlook and their day-to-day life?
Well, it's bad. I mean, let's not sugarcoat it. I mean, if the tumor in the prostate is confined to the prostate, then you can usually talk about a potential cure. You can surgically remove the prostate, you can treat it with radiation and essentially get rid of the tumor that way. You can do a combination of the two. But when it's localized and confined to the prostate, your chances of success are much, much better. The minute it spreads to the bones, you essentially can't talk about a cure anymore. There's no way you can eliminate all the tumors, because even if you could, in theory, go after all the visible tumors, there's probably microscopic little tumors elsewhere that will grow and spread with time. So it becomes a much more difficult disease to manage. And now you're talking about management rather than cure.
Well, his office says the cancer is hormone sensitive. That sounds like a bit of good news, but what does that actually really mean in plain terms? And what does it mean for his options for treatment?
So most prostate cancer is hormone sensitive, meaning that it's testosterone that makes the prostate and prostate tumors grow, in the same way that it's estrogen that makes most breast cancers grow as well. So in the same way that we've developed treatments for breast cancer that block the action of estrogen on the estrogen receptors of the specific tumors, you can do the same sort of thing for prostate cancer. And in fact, a lot of the treatments for prostate cancer are androgen blockers that, through a multitude of mechanisms, basically do block the action of testosterone on the tumors, that the tumors do not grow and can even shrink. So there are a lot of treatment options out there, and they help. They shrink the tumors, they can limit the spread, but I mean, they have let's say a limited efficacy in the long term, because eventually they stop working.
Okay. Well, we know that he is sort of reviewing the treatment options with his doctors. In this case, we also know that he went to the doctor because he had urinary symptoms, is what we're being told. So what should men then be paying attention to, and what should they be getting checked out if they're worried about this?
So there's 2 different issues here. As we get older, all men, their prostate gets bigger, and that's because of the same action of testosterone making the prostate grow. As the prostate gets bigger, it starts to block the urethra. It's harder for urine to get out of the bladder. And that's what leads to all the classic symptoms of an enlarged prostate: inability to empty your bladder, having to go to the bathroom more and more often because your bladder doesn't empty, having a weak stream, all those sorts of things. But those are all the symptoms of an enlarged prostate. An enlarged prostate does not mean cancer. The 2 things are sort of different. I mean, obviously there's some interrelation, but they're very different things. The reality is that most people, most men who have prostate cancer are not actually going to have symptoms, which is why we talk about screening for prostate cancer and all that. So in many ways, there's no actual symptom. Now, if you are having symptoms, you should definitely go get checked because you might have an enlarged prostate, you might have an infection of your prostate. It's unlikely that it's the cancer that are causing those symptoms, but as you're being worked up for all of those symptoms, that's often how we detect cancer. So it's a very complicated thing to deal with, and I think a lot of people end up conflating what are fundamentally two separate issues.
Okay, so screening is recommended when?
Oof, that's like a half-hour answer there, so we might have to clear the next block. No, the problem with prostate cancer screening is that it's a bit of a controversial issue because it is unclear how much of a magnitude of a benefit there is and whether the benefit outweighs the risk. And so you see a lot of arguments in the literature.
Okay.
The current recommendations are that after the age of 50, 45, if you have high risk features, you should have a discussion about prostate cancer screening. It's worth mentioning that neither the US nor the Canadian guidelines say it's a mandatory in the same way that we talk about, colorectal cancer screening or cervical cancer screening or mammography, where there is a recommendation of, yes, do it. Here, the recommendations are talk to your doctor, understand the risks and the benefits, because the issue with prostate cancer, although we're talking about a very bad case here with President Biden, the vast majority of men who are diagnosed with prostate cancer are not going to have an aggressive form of a disease. You may find microscopic tumors in the prostate that will never grow and turn into a clinical diagnosis of cancer. And that's where you have a discussion about, do you treat, do you watch, do you monitor? And there's a lot of disagreement about what the best course of action is. The phrase that is often used is that most men die with prostate cancer, not of prostate cancer. But it's very hard to know which one is which. And so that's why if you do start prostate cancer screening, you do it with the understanding that, yes, you may diagnose cancer. That doesn't necessarily mean that it needs to be treated right now. And then you have to start looking about the life expectancy of the patient. Do they have underlying issues and all those sort of complicated things?
Okay. Dr. Christopher Labos, we'll have to leave it there, but we appreciate your thoughts on this today.
My pleasure. You take care.
Dr. Christopher Labos is an epidemiologist and cardiologist.